The aorta is the largest artery in the body. It carries oxygen-rich blood away from the left ventricle throughout the body. The aorta can be divided into 4 sections: the ascending aorta, the aortic arch, the thoracic or descending aorta, and the abdominal aorta. The aorta comprises a thin inner layer called the intima, a thick elastic middle layer called the media, and a thin outer layer called the adventitia. These layers allow the aorta to absorb the force of blood as it is pumped from the heart to the rest of the body. When the aorta weakens, a balloon-like bulge called an aneurysm can develop. They can happen at any point along the aorta. Aortic aneurysms can dissect or rupture. The force of blood pumping can split the layers of the artery wall, allowing blood to leak in between the intima and media layer. This process is called dissection. As a result, a septum forms and separates the true lumen from the newly created false lumen. The aneurysm can also burst completely, causing bleeding inside the body. This is called a rupture and is a surgical emergency, in which 85% of patients die, and 66% of these deaths occur before reaching the hospital. The key symptom of this is a sudden, severe, tearing pain in your chest or upper back. Surgeons usually recommend surgery before the aneurysm ruptures. A guide wire is threaded through the femoral artery into the aorta during the procedure. A catheter containing the stent graft is guided over the wire and positioned inside the aneurysm. Then, the stent graft is opened, forming a stable channel for blood flow. Thank you for watching this video. Please watch my next video to learn more about the warning signs of a heart attack.